Welcome to Healing Horizons. I'm Chris Daniels, and today we're exploring why Ibogaine is becoming a go-to for veteran addiction recovery. Many veterans face stacked challenges: PTSD, traumatic brain injury, chronic pain, insomnia, and the heavy burden of polypharmacy. For too many, another pill isn't the answer. They want a reset, not a patch. We'll look at what Ibogaine is, how it works, why Mexico leads access, and how to pursue this path safely. Ibogaine is an alkaloid found in the root bark of Tabernanthe iboga, a shrub native to Central West Africa. For generations, the Bwiti tradition has used iboga in initiations and healing. Modern clinics isolate ibogaine hydrochloride and administer it in a medical setting. It is not a daily medication. It's a single, high-dose experience with careful preparation and monitoring. While spiritual for many, Ibogaine is being integrated with contemporary cardiology, toxicology, and addiction medicine protocols. Mechanistically, Ibogaine appears to interrupt opioid withdrawal by modulating NMDA-kappa and mu-opioid and sigma receptors, while its metabolite noribogaine offers sustained serotonin transporter and kappa activity. Many patients report rapid relief from acute withdrawal and a dramatic reduction in cravings. Animal and human data suggest enhanced neuroplasticity, allowing new learning to stick. Psychologically, the experience often surfaces autobiographical memories, moral insight, and trauma processing, creating a window to reset patterns when combined with structured support. The experience is intense but typically inward. Set and setting matter. Clear intention, clinicians, and a quiet, dim room. After cardiac and vital sign checks, dosing begins, often with test and booster doses. Within an hour, most enter a waking dream state, with vivid imagery and life review. Movement is minimized. Monitoring is continuous. The acute phase lasts 8 to 12 hours, followed by a reflective, low-sleep integration window where insights crystallize and cravings remain unusually quiet. Evidence is growing but still developing. Observational studies show high rates of acute opioid withdrawal suppression, reduced cravings, and clinically meaningful decreases in depressive and PTSD symptoms for many, especially when aftercare is strong. Small prospective cohorts report improved quality of life and reduced substance use at 3 to 6 months. However, randomized controlled trials are limited, long-term data are mixed, and selection bias is real. Ibogaine shows promise, but it is not a magic bullet. Safety is the headline. Medical screening includes a detailed history, medication review, physical exam, EKG to assess QT interval, and labs for liver function, electrolytes, and hemoglobin. Clinics should stabilize sleep, hydration, and nutrition before dosing. During treatment, continuous cardiac and pulse oximetry monitoring is standard, with a physician present or immediately available. Emergency readiness matters. Defibrillator, oxygen, IV access, antiarrhythmics, and transfer agreements with a nearby hospital. When protocols are followed, risks are significantly reduced. Contraindications include significant cardiac disease, structural heart abnormalities, uncontrolled hypertension, history of arrhythmia, and prolonged baseline QT. Liver failure, severe electrolyte imbalance, and active psychosis are also concerns. Medication interactions are critical. Avoid QT-prolonging drugs, certain antidepressants like citalopram, tricyclics, some antipsychotics, and many antibiotics. Methadone and long-acting opioids are risky. Most candidates transition to short-acting opioids and taper before dosing. Always coordinate changes with your prescribing clinicians and the Ibogaine medical team. Who does well? Motivated individuals who can participate in preparation, tapering, and integration. Veterans with supportive family or peer networks, stable housing, and a willingness to engage therapy post-treatment tend to sustain gains. Medical suitability is essential. A normal EKG, manageable medications, and the ability to shift from methadone or benzodiazepines under supervision. Finally, realistic expectations help. Ibogaine can open a door, but you still need to walk through it with daily practices and support. Why Mexico? Ibogaine is unscheduled there, allowing regulated clinics to operate with physician oversight. Over the past 2 decades, Mexico has developed some of the most experienced medical Ibogaine teams, many serving veterans. Access is faster than in countries with prohibitions, and costs, while not trivial, are often lower than repeated detox, inpatient stays, or years of medications. Proximity to the United States simplifies travel and aftercare coordination, and some programs offer veteran scholarships or packages. Choosing a clinic is mission critical. Look for physician leadership with credentials in emergency medicine, cardiology, anesthesia, or addiction medicine. ICU-trained nurses and 24/7 bedside monitoring should be standard. Ask about their pre-screening process, medication taper plans, individualized dosing based on weight, EKG and liver function, and what emergency equipment is on site. Verify transfer protocols with a nearby hospital. Request transparent, de-identified outcomes, complication rates, and aftercare partnerships. Quality programs welcome rigorous questions. Red flags are equally clear. Be wary of one-size-fits-all dosing, minimal or no medical screening, or clinics that won't coordinate with your prescribers. Avoid programs without 24/7 monitoring, without an EKG before and after dosing, or without emergency gear. Watch for pressure sales tactics, guaranteed cure language, and social media hype with no data. If cost is the pitch and safety is an afterthought, keep walking. Your life is worth a meticulous standard. A solid treatment flow starts weeks in advance. First comes medical workup and a collaborative medication plan, including tapering opioids, benzodiazepines, or antidepressants when appropriate. Stabilization focuses on sleep, hydration, and nutrition. On arrival, baseline vitals, EKG, and labs are rechecked. Dosing is weight and response-based with careful titration. Patients remain on monitors through the night with skilled staff bedside. The following days prioritize gentle movement, light meals, hydration, and structured integration conversations. Integration is where gains become durable. Evidence-informed aftercare includes trauma-focused therapy such as EMDR, cognitive processing therapy, or somatic approaches. Peer support with veterans who understand the culture, and coaching to translate insights into routines. Sleep hygiene and nervous system regulation are crucial. Sunlight, breathwork, and consistent schedules. Nutrition and gut health aid mood stability. Movement progresses from walking to strength. Finally, purpose building, service, creativity, family, anchors the new trajectory beyond the initial glow. Where does Ibogaine fit among options? Medication-assisted treatment like buprenorphine and methadone saves lives and remains essential. Some veterans transition to MAT after Ibogaine. Others use Ibogaine to move off opioids entirely. 12-step, smart recovery, and psychotherapy offer community and skills. Ketamine can rapidly ease depression and suicidality. MDMA-assisted therapy, pending approval, targets PTSD. Ibogaine is distinctive for interrupting withdrawal and catalyzing insight, but it works best when integrated with ongoing, evidence-based supports. Consider a composite Marine with a decade of opioid use after blast injuries. He transitions from methadone to short-acting oxycodone, tapers, stabilizes electrolytes and sleep, and completes Ibogaine with continuous monitoring. Withdrawal is muted, cravings drop from 10 to 2, and nightmares recede. Another example, an Army medic with alcohol use disorder and hypervigilance. After Ibogaine and structured therapy, she reports fewer startle responses, clearer boundaries, and renewed purpose mentoring younger veterans. Continued care sustains momentum. Ethics matter. Informed consent must be thorough, covering benefits, unknowns, and risks, including rare but real cardiac complications. Respecting Iboga's cultural origin is essential. Credit the Bwiti lineage, avoid extractive attitudes, and support sustainable sourcing. Clinics should verify supply chains that do not incentivize poaching or deforestation. Transparency about outcomes, costs, and staff credentials builds trust. Finally, no program should discourage standard treatments. Responsible teams collaborate with your doctors and therapists, not replace them. Practical preparation smooths the road. Ask providers about screening, dosing logic, monitoring, and emergency plans. Share your full medication list and consent to coordinate with prescribers. Begin sleep hygiene, hydration, and nutrition weeks ahead. If tapering, move slowly, guided by clinicians, and avoid last-minute changes. Plan time off work, pet care, and transportation. Set intentions on paper and inform trusted supporters. Arrange therapy appointments for the first weeks after treatment when motivation is high. Access can be a hurdle, but support exists. Several nonprofits and veteran-focused programs offer partial scholarships or sliding scales. Ask clinics for a current list. Some organizations assist with travel logistics and integration coaching. Telehealth makes pre-screening and post-care more feasible across borders. Seek providers who understand VA benefits and can coordinate documentation. For integration, look for coaches with trauma, addiction, and psychedelic-informed training, ideally with veteran experience. Community multiplies the gains of treatment. Set realistic expectations. Ibogaine can deliver a profound reset, but the brain and environment still need tending. Expect renewed energy and clarity, yet also periods of fatigue and emotional sensitivity. Sleep may be irregular for days. Cravings often drop dramatically, but cues and stress can reignite patterns without new skills. Measure success in months, not hours. Commit to therapy, peer support, movement, and purposeful structure. Ibogaine opens the door. Your daily choices keep it open. That's our episode of Healing Horizons. We examined why Ibogaine resonates with veterans, stacked burdens of PTSD, TBI, chronic pain, and too many pills. How Ibogaine interrupts withdrawal, quiets cravings, and catalyzes insight. What the experience entails, and how to choose a safe clinic in Mexico. We contrasted options, highlighted integration, and shared stories. The value is clarity, safety, and hope. If this helped, subscribe and share. I'm Chris Daniels. Stay safe, stay supported, and keep going.